You're welcome back. Now, in our main story on the Pulse today, we're dealing with mental health to commemorate World Mental Health Day. Now, in the studio with me is Dr. Kwabena Kusi-Mensah. He's a psychiatrist at the Komfo Anokye Teaching Hospital. He's here to help us understand and deal with cases of mental problems. And of course, Maps is still here with us, and she'll be sharing further details in just a moment. But first, let's say a good afternoon to the good doctor. How are you?
Fine, thank you. How are you doing?
Not bad at all. Now, of course, mental health is an issue that is far broader than most people consider. In Ghana, perhaps we only see it when people are walking along on the streets, visibly disturbed. But mental health runs a whole spectrum of conditions and illnesses, doesn't it?
Absolutely, absolutely. And I'm glad you started on that note. Today I was sharing at the World Mental Health Day celebration that, you know, somebody will ask, why talk about mental health amongst children? I mean, we say in our local parlance now, in Kolanso, so do children also have mental problems? And the truth is that problems or troubles are very relative. What you consider a trouble for you may not be a problem for, let's say, somebody like Dangote. In the same way, what you think is trivial to a child is a big deal. If you promise a child, for example, that, oh, today, Abdul Okojo, if you do well or if you come home early, I'll buy you yogurt, and you don't buy that person yogurt, that disappointment is as huge in magnitude to the child as perhaps somebody of our age suffering a heartbreak. So because of that relativity, all spectrums of the human age group go through mental challenges because it's a relative issue. Once I perceive it as a serious problem for me, I can go through the full gamut of mental health problems regardless of whatever age that I'm at.
Right. So what are some of the main triggers? I mean, can we enumerate some of the things that could lead to mental illness?
Yes. So I like to simplify things. It all boils down to stress. Stress is basically the way in which you perceive anticipated problems. So it's not necessarily how big the problem is, it's the way in which you perceive it and then your own view of your capacity to cope with the stress. So all the various triggers in one way or the other lead down to that common pathway, whether it's relationship issues, whether it's money issues, poverty, there's no money in your pocket, the way you relate with other people. I don't mean necessarily even romantic relationships, even parent-child relationships, peer relationships, many, many different things, self-image issues. It's, if you feel that there's a challenge that you don't have the capacity to meet and your body and your mind is not able to meet it, you are likely to develop mental health challenges if you are predisposed.
Right. Now, I want us to touch on drugs, particularly marijuana, because we tend to have this belief that, you know, it's one of the consequences of smoking marijuana is that you develop a mental illness. How accurate is this? Is it really such a direct correlation between smoking weed and losing your mind?
Very good question, and it's interesting that this has garnered a lot of controversy lately. The truth is that we always say the truth is somewhere in the middle. There isn't a direct correlation. It's not like it's not as directly as, for example, if mosquito with falciparum bites you, malaria directly. No. However, studies have shown that there's a very strong association, particularly depending on certain factors, depending on the grade or the amount or the potency of the active ingredient in the marijuana, the tetrahydrocannabinol, how much of it in the marijuana, because it varies depending on the different areas in which it's grown and things like that. And I have heard, I've not verified, but that the Ghanaian one is of particularly high potency, has a high THC to CBD ratio. The other things that also mediate it is how frequently and how often, and then the age at which you start smoking, consuming the marijuana. And then most importantly, if you already have the predisposition to mental illness, so if there's a familial predisposition to, let's say, schizophrenia, or then some sort of mood disorder, bipolar disorder and things like that, you and your friends will go out, you take the spray for whatever, and they will be fine, you will not. So it's a bit more complex, but there definitely is an association. It's not a direct one-to-one mapping, but definitely there is a definite association with smoking cannabis and psychosis.
Right. Now, CDD Ghana has issued a statement, very interesting statement, where they call for certain things to be done in Ghana to help in the battle against mental illness. I want to go through some of them with you to see what impact this will have on the work you do and our ability to manage mental illness here in Ghana. The first one, I think, stands out. Yes. They are calling for that LI,
absolutely,
which has been in abeyance for God knows how long. Tell me, why is this LI important, and what does this absence prevent you from doing?
I would say that the LI is what operationalizes the law. The law is great, it's fantastic. I mean, anywhere we've gone to on international fora, Ghana is cited as one of the model childs of Africa. In fact, it's just us and I think South Africa that has a modern law. But the problem is that the Act of Parliament is the overall framework. In terms of the operationalization of it, there are certain specific things that the Act stipulates that hasn't been specified who is going to operationalize it. For example, it says in the Act that mental health care shall be free. Now, free means free, but it doesn't mean somebody has to pay for it.
Indeed.
In the grand scheme of things, what it has worked out to is that as noble as the idea of free mental health care is, because it says it's free, for example, national health insurance, it does not cover a lot of the conditions, because if mental health care is free, then insurance shouldn't be paid for it, because insurance is not free.
Yeah.
You get the point. So that, for example, is one of the kinks. So the LI has to spell out, okay, so if it's free, who should pay for it? Should we get it from Get Fund? Should we get it from who specifically within the government apparatus? So because that hasn't been spelled out, so me, for example, in my hospital for a long time, we've not had the medication that we are supposed to get. So our clients invariably have to pay for their medication and many of the other services. So the actual effect is that now there's a lot of the services that people have to pay for, because even though the law says it's free, there's a battle as to who it is that is supposed to pay for it, and so it becomes of null effect. And that's just one example. There are many others, nitty-gritty details that, so if this LI comes to pass, it would really turn into reality that fantastic, beautiful law that we've promulgated. Yes.
And then, of course, the call for more resources
Yes.
to be provided. The CDD calls for that.
Absolutely.
Tell us about the reality of your resource lack.
I don't even know where to start from. The last time that the scientific study was done in Ghana, which was 2011, the treatment gap for mental health care was 97.2. That means that if we take, for every 100 people who need mental health care treatment, only 2.8 get that treatment. It has to do with lack of personnel. We don't have enough psychiatrists. And the whole Ghana has about only less than 25 practicing psychiatrists, which means that our ratio is 1 psychiatrist to 1.2 million people, which is woefully inadequate. At our level as a lower middle income country, we are supposed to be doing 1 is to 100,000 at the least, at the minimum. And yet 1 is to 1.2 million, we are at the level of a low income country, as low as, on the scale. And that's just on the level of human resource, even in terms of facilities. Now we are shifting away from institutionalized care to more community-based care, because studies have shown that when people are access care in their natural surroundings, you de-institutionalize the care, the response is better. It's easier for somebody to go to their community health nurse, or to have even the nurse visit them at home and take their medication, issues of stigma and things like that, rather than ask them to go, for example, to Accra Psychiatry or to Komfanochi Psychiatry Department. So we need more community centers, we need people to staff it, we need medication, we need a whole gamut of resources. The kinds of medication, even the allied staff, psychologists, occupational therapists. I'm very particularly interested in child mental health. We are very, very deficient if we don't have enough child psychologists, if we don't have enough occupational therapists, people to help, physiotherapists. There's a whole gamut of
Let me ask you a direct question. You're at Komfanochi.
Yes.
For 2018, how much did you ask for, and how much did you get?
That's is a very difficult question to answer. I don't have the figures off the top of my head. At this point, the way the system works, the subventions are brought in from the central stores, and our requests are the same all the time. But because of the issues with funding, even the Mental Health Authority itself is starved of funds, which is supposed to be the government agencies supervening all mental health problems. But luckily for us, because we are in a semi-autonomous center, we have had to find innovative ways of coping and surviving in concert with the CAF management. Of course, it's never enough in terms of what it is that we want to receive. We don't receive much resources from central source. That is the honest truth of the matter. And I believe that if the LI is passed and it's spelled out clearly who is funding the mental health fund, then everybody, every part of the country, every facility will get their fair share, so we can cater for our clients.
Now, this mental health authority you've mentioned, they don't even have a governing board. This is another thing that has delayed.
Yeah.
But president has appointed boards to most, if not all, state institutions. I mean, has this been the case even under previous administrations? I'm not trying to play politics with this. I just want to know, how long has this authority not had a board?
It's a long-standing problem. The law was passed in 2012. To the best of my knowledge, I believe the management of the mental authority was established somewhere 2013, 2014. From that time till now, I have not heard that a board has been constituted, which is a real shame, because if you don't even have a governing board that's going to supervene the activities, checks and balances and things like that, how are we even going to implement policy or even make policy? As we sit here, Ghana doesn't have a child and adolescent mental health policy. So I cannot, for example, as a person interested in child psychiatry, I'm interested in the mental health of children. The government doesn't even have a policy statement that I can hold them to, because that's what policy is essentially. That, oh, this is what we are going to do so far as this is concerned. They haven't even come out with that. If you don't have a board, where do we even begin to start? To hold them to account. So it's a real challenge that right from the very top, things need to be moved much more quickly and put in place to take care of the health or care needs of our people.
So, how attractive is the profession to those who are coming up in the ranks? How many people say, I want to be in mental health?
Mental health person. Well, I get that question quite often. I mean, I always share my personal story. When I said I was going to do psychiatry, my parents was like, we sent you to medical school to become something more dignified and respectable. We want to become mad people's doctor. But today, my mom is my greatest cheerleader. I mean, she's one of those, she's very, very proud of me, not because she's understood what my vision was, why I went to it as a young person. I think, and the reason I went to it is because I feel that I became a doctor because I wanted to help. I wanted to really make a difference and to serve people. And in my thinking, if you want to help, which is the greatest area that needs the greatest need? And as of the time that I was making the decision, mental health care has the greatest lack. I mean, 25 doctors for a population of 27 million. And this is even the better situation. When I was entering, there were less than 10. So the future is very bright. I always say that don't look at the present problems that you are facing. Look at the potential for growth. Look at the potential for change, the potential to make a difference. And after all, if there isn't a problem somewhere for you to solve, how are you going to leave a legacy or do something worthwhile? And so things are getting better. The world is getting more interested in mental health care, and today, even around the world, the cutting edge science, medicine has discovered a lot of things. The final frontier for discovery is mental health. The whole world wants to understand mental illnesses, what causes it, what is the problem. So there's a very, very bright future. There's an open field, there's a lot of space. Whatever specific area of mental health you want to focus in, you would probably be one of the few or one of the first in the field to be able to make a lot of difference. So I always encourage my medical students, my other even secondary school students, anybody, consider mental health as a very viable, fulfilling, long-term career.
Right. Well, that's quite revealing, and I wish there were more who had the same vision that you had at the beginning of your career. Still here with me, though, is Maps, and we asked you a question on Facebook. We wanted to know between alcohol and drug abuse, which are accounting for increasing cases of mental health problems among the youth, what do you think can be done to address this problem? Maps, what exactly did people tell us in response to this?
All right, let's start with Darlington Selassie, who says drugs and most alcoholics drinks should be banned from being sold at high percentage, exceeding standard rates and accepted. Hence, too, must not be imported into the country. And Ramos Jones says politicians are the cause. The government should honor their promises and make the youth make a good living. And John Benner says, for sure, especially drug abuse. And he says weed. And Matthew says, yep, it is true. Alcohol is the major. And Gandhi Nima Kid says, SAC should give hashtag and advice. And the last one is from @DK, who says youth employment.
Wow, fascinating stuff. Thank you for that. And keep your comments coming through. We'll absolutely love to share them as they come in. Oh, there's Maps with the latest from social media. But Doc, I was saying I wish there were more people who had your vision. But what exactly is it that makes mental health profession unattractive? You've talked about, you know, the fact that people aren't coming, but why? Why?
A lot of it is the stigma. That is the truth. I think a large chunk, if people didn't have the perceptions that they had about mental health in general, I feel like it would be like any other professional specialty. But the problem is that mental health is highly stigmatized, right down from the patients to even as the care providers. I mean, even in our hospitals, like I'll share the example of my parents. It's like, you will be a doctor, and why would you want to go into psychiatry? I mean, go and do some, you know, ONG or something, you know. So the stigma is a very big part of it. I think that the other problems are also avenues for the medical field, avenues for specialization, and that's generally a bigger problem. That's not just peculiar to mental health. I mean, generally getting to residency program has become increasingly more difficult, sponsorship and funding. The other thing that I've also noticed is that when it comes to the psychologist field, I feel like there are very limited avenues for training into clinical psychology. You get a lot of people doing BA or BSc psychology in Legon, in UCC, in KNUST and things like that. And more than half of them finish and then they end up in banks or in some other institution, because I feel like there's not enough avenues for training at the master's level for clinical psychology. Part of it has also been just the general wrong notions that people have about mental illness as incurable. I've spoken to medical students who have said to me that they feel like coming into mental health is a dead-end place because you won't even be able to help anybody. Everybody, there's nothing that you can do for them. So what's the point? Which is a wrong notion. I have been there and I've seen many people, even with addictions, become free of their addictions, you know, with serious mental illness. Things that, you know, I share the story all the time. There was one person who came and they were like, no, this one is spiritual. It's not Dr. Yari, in quotes, quote unquote. After about 2 weeks or 3 weeks of treatment, you know, I called the mother back and said, is this still spiritual? How come my medicine has been able to drive away the demons and the witches? And we laughed about it. But people have those notions that it's spiritual, it's not physical, and things like that. And all of that adds to the difficulty for people to make that choice to come into the field. But gradually things are changing. And I know that in the next few years we'll see a revolution.
Right. Well, let's very quickly, I just wanted to ask you this one thing before we moved on. Other countries have managed to deal with the stigma. In the United States, just as recently as the 50s and 60s, they also thought mental illness was a no-no. Yeah. But now, having a therapist, it's almost like, you know, having a nutritionist. Exactly. It's a sign of affluence, almost. What do you think it will take for Ghanaian society to move from where we are to where we ought to be, where we understand that this is just an area of health that we must
like
look
any
after?
Other. Programs like this help a lot. We are making strides in that direction. It's a gradual process, but I think we can speed it up. Social media, advocacy. When we get to the point where ordinary people, students, workers, ordinary people who are not related to mental health in any way, are able to come out boldly and speak about their experiences with their own mental health challenges, or with their relatives or colleagues who had mental health challenges, I think that is where we begin to break the ice, because then it humanizes it. It makes us see that anybody can have it's just like having a liver problem or a heart problem, and it's a health concern that anybody can develop health. And gradually, as we talk more about it, speak up more about our own experiences, we realize that it's been like, to use the mental health term, a delusion that the society has had about the stigma. It's not really as we have perceived it to be.
Doc, thank you so much. This has been enlightening. Our regards to your colleagues back at Komfo Anokye. They're doing a great job.
You.